I'll give you a guess. What do you think we're talking about today? The aging face. And that guy right there. So a lot of people come in concerned. They feel like there's a discrepancy between how they feel, youthful, energetic, outgoing. They're doing more than they've ever wanted to in their life, but they look like their mom or their dad. So what's the solution here? Well, we want to be really thoughtful about how we restore what's missing. So if aging is a three-step process where essentially you get loss of facial fat, you lose elasticity, and you start getting skin changes, things like sunspots, red spots, brown spots, things like that, that if we can address each one of those in their components, we're going to get a much more holistic rejuvenation that makes you look like something, nice and youthful like yourself, maybe 10, 15 years ago, not like somebody totally different. So how are we going to go about doing that? Well, in this particular patient, there were a few things that bothered her, and I'll show you what. In addition to the jowl that was better highlighted in the last photo, we're looking at an obtuse cervical mental angle, some fullness along the jawline. It kind of interrupts that area. You see this marionette line over here, a deep nasolabial fold. And as we start to look a little bit closer, we even see that there is a little bit of a depression right through here, that her brow had started to become more prominent. The other thing that troubled her was right here, the radix, the very root of her nose. She felt like she had never had a hook nose before, like a little bump on her nose, but she wanted to be able to address that without having a formal rhinoplasty or nose surgery. As we start to move further down the face, again, we're going to address that nasolabial fold, marionette line, genomandibular groove, highlight that jawline, and ultimately, I'll show you what we do here. Here we go ahead and we're going to start with talking about what we did for facial fat transfer. So again, if we are looking at that prominent brow, you start looking over here, nice and smoothed out. So we were able to graft her forehead, her glabella, her temple areas that had become a little bit hollow, her supraorbital, infraorbital, mid-face, her whole cheek, nasolabial fold, marionette lines, jawline, genomandibular groove, and then of course we've got that nice, sharp cervical mental angle coming through here that everybody's looking for to give them that more youthful appearance. We'll go ahead to the next view. So here you see 3 months after, what we're seeing here is that we've got that nice, crisp jawline. There's some swelling there that's still going to continue to resolve. However, that jowl is lifted. Marionette line is significantly improved. You even see a little nice upturn in the corner of her mouth there. Makes her look nice and pleasant and just, rejuvenated, a little bit more youthful. You can see that even the lines through her mid-face there have been reduced, and even the vertical lines around the mouth that were a little bit more prominent on this side have now been addressed both with fat transfer as well as a laser resurfacing. And that smile says everything. Look at that. She looks like a more youthful version of herself, doing